We are in December. Happy New Year, everybody. Forget about Christmas. That was last month. We are now into the new year. 1st of December. Globally, this day is marked by World AIDS Day. And we talk about this. Even last year we had this conversation. The journey towards addressing HIV and AIDS in the country has been long. One of the people who's been long on this journey is CT Muga. The other one is Professor Walter Jaoko. Both are in the studio with us. Professor Walter Jaoko is the director of the KAVI-Institute of Clinical Research, and he's a member of the HIV and AIDS Tribunal. Good morning, Prof.
Good morning.
Karibu sana to Kenya's biggest conversation.
Thank you.
Again. You remember this gentleman?
Yeah, we grew up together.
You grew up together.
People who think I don't have friends. Yeah.
People who think you're not grown up.
Yes, they have brought themselves and they can tell you. Somebody will tell you, I used to see CT running naked as a child.
This is one of those.
Not now. Historic experience.
Okay. Welcome, Prof.
Thank you very much.
City has the day's proverb. This week's proverbs are from
the Republic of South Sudan.
Okay.
Are we good there?
Yes.
Not Southern Sudan?
Not Southern Sudan.
South Sudan. Okay. People must not be corrected at their departure time.
People
must not be corrected at their departure time.
Prof, what's your interpretation of this one?
Well, I think it's, to me, it's like that time you're supposed to have good memories of the last time you're in contact with a particular person. So if you're being corrected, that is a memory that will stick. So imagine that if there's anything else, correct them before that time. And then when you're time to part, that is the memory that will stick.
How very well put.
He's looking at it from the perspective of the person who's leaving.
Yes.
Okay.
It is so true.
You don't want them to go with a butt test in their mouth.
Yeah.
Did you ever have these sessions in school when you're about to leave? That is secondary school. When people are making speeches of some sort and saying, if I've done anything wrong, I want you to forgive me. That one. And I'm thinking, you had what? How many years to make it right?
Yeah.
Now on this last day, you think I'm going to forgive you? I'm definitely not forgiving you.
Oh, wow.
Na kama ulinikosea
wewe
nimekusamehe. Na yule nilikosea anisamehe. Prof, the HIV and AIDS Tribunal, we'll talk about the KAVI-Institute shortly, but the Tribunal, just remind everybody who has not heard of it before, what is it?
So the tribunal was set up under what you call the HIV and AIDS Prevention and Control Act. Basically, it is to address matters HIV and AIDS. And it focuses on 4 main areas. One is non-disclosure of somebody's status. That if you know somebody's HIV status, that's a private matter. You have no business disclosing it to somebody else. It addresses the issues of privacy and confidentiality. It addresses the issues of consent before HIV testing. It addresses the issues of pre-test counseling and post-test counseling, that I cannot just go to a health facility and they do a HIV test on me without, first of all, pre-test counseling me, and then after the test, doing a post-test counseling. And finally, it addresses the issues of discrimination, that just because I'm HIV positive, you should not discriminate against me when it comes to school admissions, employment. I should not be terminated just because my employer has found out that I'm HIV positive. The reason for this is to address the issues of HIV. There's a purpose for this, because when we do not do the things that I've mentioned, it contributes to the spread of HIV. People go underground. People do not want to disclose their status. People do not. So there is a reason why the act was made. It's the only HIV and AIDS tribunal in the world, and people are looking up to us as a country on how we have been handling matters HIV.
So the people who appear before the tribunal are people who feel that any of these of their rights have been infringed.
Yes.
Upon non-disclosure, privacy and confidentiality breached, they've been forced to undergo an HIV test. There was no pre or post counseling. They've been discriminated based on their status. Which of these has more complaints?
A lot of from my experience, I've been in the tribunal now for 1 year. It's a 3-year renewable. For the 1 year that I've been there, the majority of those have been where people's HIV status have been disclosed. Yeah, to other people. To third parties.
By who?
So somebody knows that I'm HIV positive. Probably I disclose to that person. And it's interesting. There are very different forums that this has happened. So we're in a WhatsApp group together. And then, we disagree, and the next thing you post in the WhatsApp group, to a HIV. So that's a common one. And the other one is where people are being discriminated because of their HIV status. So I'm an employer, then I have an employee who keeps on getting sick, and then I collude with the health facility. When they come, test for HIV, and because I'm paying, you test, then you know the HIV status, then you disclose to me. A few months down the line, I'm dismissed, but you don't know why I've been dismissed. Then you discover, my HIV status was disclosed to my employer.
So none of this actually has gone to the healthcare professionals yet, right? Because that one of a breaking of privacy, I thought it was going to come from, a healthcare professional who's done the test, then passing on that information to a third party. So this is basically somebody confiding in someone, and then that other person now breaking that trust. Mostly what you see.
In the first case. The second one where I described, actually there are two things that have happened.
There's a healthcare professional involved here.
Yes, who has that health professional. You can sue that health professional and the health facility for disclosing your HIV status to a third party. Because when I come to see you as a healthcare profession and you do a HIV test on, even whether you pre-test cancelled me and post-test cancelled me, you have no business even informing that, even to my spouse without my consent. So when you inform my employer, that is a third-party disclosure, and it is against the law.
Okay. In fact, Walter, let's take the discussion further to even children. Anyone who's under the age of 18, there's a constant in all these matters. It's called consent. In the absence of consent, because it's a question you'll ask, can a parent go to a health facility and ask about the status of their child? And if they do, what will they be told?
A parent asking about their own child?
Yes, let's say a
who's
child
under 18.
Yes.
Yeah.
Will they be told?
Should they be told?
I'm posing this question so that Walter, with the tribunal,
yes, so that is a minor, and for purposes of this, yes, as a parent, you'd be disclosed. But if that child is 18 years and above, you have no business disclosing. For a child, you need to know.
Okay.
This is somebody who is under your care. You're the one who is going to provide all this treatment and all this. They are not reached the age of majority where they can make decisions for themselves. But when they are over 18, even if you're taking care of them, because now they are considered adults, you should not be told their HIV status without, first of all, you talk to the child who is, let's say, 19 or 18 and a half or something. And you say, okay, this is your situation. And this would happen in the post-test counseling. Even in the pre-test counseling, we say, we want to do this HIV test. These are the consequences. Should it be positive? We need to do this and this and this. Would you allow us to discuss this with your father or your mother? And if the child who is above 18 says no, imagine you can't.
Is it prevalent in terms of those who sought recourse? Is it prevalent enough? Or rather, is the issue so prevalent that we have many people going to seek recourse? Was there a time whereby there was not enough knowledge about how to then deal with HIV status? We're not even talking about the disease, now looking at the social issues around it. So much more that people would be careless in the words that they spoke or the information that they disclosed, that people went to seek recourse that it became so frequent, so much so that we now have to go and look back at sensitization over some of these things. And as they sought this recourse, have people then been, what's the word I'm looking for, compensated for any kind of damage to their person or to their character?
You're asking an interesting question, because when I joined the HIV and AIDS Tribunal, I thought that we had moved so far that such cases, the cases I see in the tribunal, would not be happening many years after the HIV. As you mentioned, CT and I have been involved in this field for many years. I was surprised. Even schools, headmistresses not wanting to admit a child because of their HIV status. So you're right, you'd expect that by now, having had HIV for this long, the issues of discrimination and stigma would have reduced. Unfortunately, it's still happening. I could not believe it as a healthcare profession to hear cases where a fellow healthcare professional has done HIV test without somebody's consent and disclosed it to the employer. Now, for each of these cases, we have to, because it's a tribunal, it's a court, you have to hear the evidence from both sides. So there's some situations where you find that there is no sufficient evidence. So we do not, just the fact that somebody comes and say this happened, we do not make conclusion, but we listen to the evidence. And you're right, we award. The tribunal has the powers to award compensation. We can determine, we can give orders as to, for example, you should not continue doing it because you have done it. You pay a fine, but you are given also restraining orders that you cannot continue disclosing my HIV status. So in short, I would have expected these cases to be very few now, but unfortunately we keep on getting a lot of filings.
Okay. What's your caseload like?
So this is the reason. So at the moment we would deal with about 70 in a year. That's an average one. But part of it is just because of many people still do not know about the HIV and AIDS Tribunal. We go to places for sensitization and people hear about it for the first time. So one of the things that we're trying to do is to publicize the tribunal. We go to different parts of the country to just sensitize people on it.
Okay.
And the cases would be much higher.
Okay. There's a question I'm not really sure where it falls, so just looking for some guidance here. Because when we look at it in relation to HIV and look at the years that we've come, whereby conversations have split almost in their personality, but then coming back to hear that you're surprised that some things are actually happening that shouldn't be. I mean, how many years, decades into this? But one of those is around blood donation. And we know that once you donate blood, there's a mandatory testing that must take place at the point of care in hospitals, right? And these are issues that might come before the tribunal, even when we talk about celebratory on this day. We know that they must test this blood. We also know that it is absolutely mandatory for somebody to speak to you as an individual should they find something. So it becomes very gray area, doesn't it? Whereby I did not ask you for a test. I've come to donate blood. Should you find that there's something in my blood, the duty of care is on you to tell me something that you'd find. So how are such issues being dealt? If they find that this blood has discrepancy, they will get rid of it. But do they have a responsibility to tell you, the individual, that there's something off here? But then where can that fall when I did not ask you to give me that information?
Okay, so the law has some exceptions with regard to consent for testing and pre-test counseling, post-test counseling. And one of those is blood donation. But they should be able to get back to you should that happen, that you are HIV positive. Then they should be able to get back to you. And the purpose for that is for standard of care, as we say. Because we have a concept now, unlike when HIV first started, we have a concept of test and treat. At the beginning of the HIV pandemic, we would be waiting for your immunity to go to below a certain level. There are many reasons for that. We did not have enough drugs, and the drugs were also very toxic. So we wanted to balance between that and your health. But now we have safer drugs, and the drugs have become very available thanks to the US government with the PEPFAR program. And so now when we test you and you're HIV positive, we start treating you immediately. And evidence has shown that those who are treated immediately have better outcomes. They live much longer. The complications of HIV and AIDS is much less. So for that purpose, if we test you as a blood donor and we get that you're HIV positive, then we need to contact you and advise you to get treatment.
Okay.
On the issue of the minors, take a case where a child is born with HIV, parents die when the child is young, and this child is then being taken care of by a guardian, family member, or something, all right? And the child has to go through school. The child will need to be going, to see their doctor regularly. The child may need some sort of special diet. The child may need some care, and they're in school. So it's important at some point that the guardian will have a conversation with, like, the school head.
Yeah.
Is that disclosure allowed? Can the child come back after they've become an adult and say, you exposed me?
No, that disclosure is allowed. So the disclosure that is allowed is a parent or a guardian. And what the case you're describing is very common. Used to be common, now it's less common because of the treatment that we give. But when many of us have taken care of children whose parents passed on as a result of HIV/AIDS, and you treat them as your child, and the law gives you that responsibility as a parent, as a guardian. This is your child, you're taking care of the child. You need to disclose so that the child gets treatment. The case you've described, the challenge usually is not even more of disclosure to a health facility, but disclosure to the child themselves. And we're seeing cases where kids have grown not knowing that they're HIV positive. The guardians have a challenge of explaining that, and they tell a child, you have a health problem that, you have to take this medicine. So the child grows up knowing that they're taking medicine not for HIV, but another condition. And then they discover later. And that is a lot of strain in the family. And the challenge usually is, at what age should you disclose the HIV status to such a child? And that is where the counselors also help, and they can let you know when is best to do it. Yeah.
It was always a challenge. And that's why the program that I worked with for the longest time, it was called FACES, the FACES program. They realized that to really get to the bottom of managing, treating, and reducing stigma, the care process has to be for the family, not for the individual. So that's why it was family, AIDS care, and education services, because you didn't only treat, you educated. Someone was HIV positive. The process of counseling, you got them to bring the entire family. So that the entire family knew the status, whether it was the father or the mother. Children were then tested. And then you brought in children's clubs, so that children who are HIV positive had specific days on which they could come, so they don't even mingle with the adults. Because again, stigma has a nasty way of always preventing the best that could happen for someone. So the innovation that was required to ensure that the care that people who are HIV positive received was something that had to constantly be evolved to look and understand from the patients what they need and how best that can be provided. And once the stigma got reduced, you then realize that when you're talking about groups where people can talk about their condition, it became imperative to actually ensure that the community health workers were HIV positive themselves. So when you have somebody who is talking to people, they themselves are patients. So they can tell you, this is what I do and these are my drugs. And it helped reduce stigma significantly. When you find a situation where you're sitting with someone at, say, a funeral and saying, give me a second, I need to take my medication. I am this and this and this. And they're sitting there and they take out their drugs and they take it. You realize that the stigma has gone down significantly. So it was and is a process that it hasn't ended. Because the thing about HIV It's just not talked about as it used to be, but it hasn't gone anywhere. Yes.
It's still there.
Yes. It's like we don't talk about COVID, but it's still there.
Prof, so how does this tribunal basically work? It's under the judiciary, where when somebody comes and they present a complaint, how do you go about adjudicating this particular dispute? An issue of non-disclosure, how do you prove it? Or what do you look for as a threshold for proof? Or breaking of privacy and confidentiality? Or that, you tested me, but you did not give me pre-counseling or post-counseling. What's the threshold here for you to actually verify that the claim carries weight?
Yes, so this, first of all, when somebody feels aggrieved and they contact the tribunal, we have what you call pro bono lawyers. They are lawyers who volunteer. They're really our heroes. They're people who are willing to hear the case that somebody has and take the evidence and see whether it is sufficient evidence for us to bring to the tribunal. So they get assistance. So they write what we call a statement of claim with the assistance of a lawyer to go to listen to the story and produce the evidence, because it's a court. The tribunal is a court. So we need the balance of proof. What one person says, they produce the evidence. So, for example, the first case that I've mentioned to you of disclosure, where somebody knows my HIV status, we disagree, and they post it.
They broadcast it.
Yep. So the person comes with evidence showing a post on the WhatsApp group page from the number that this person is using the phone. The lawyer even checks and finds that Safaricom has registered you. It is actually CT. So that's evidence that this is what you did. And so it's a matter of evidence. So the cases where somebody was tested and without getting pre-test counseling, we get the hospital to show their procedures for testing and pre-testing and counseling. And if they have recorded the pre-test counseling, and then they should also record the post-test counseling. So there is always evidence, and we listen to both sides and then make a determination.
Within how long should you determine a case?
Yes, so the purpose for the tribunal is that the decisions should be done very quickly. And that is why, rather than going to the normal courts where things can drag forever, we have a maximum of 6 months in which to determine. So we aim for much higher than that, much faster than that, depending on the workload that we have. But within 6 months from the time you reported this case and it came before the tribunal, because there could be other cases before yours, but within 6 months you'll have gotten a determination.
Usually, what is driving a complainant to come to the tribunal? In the case of maybe discrimination based on status, they may be seeking to be reinstated to their workplace and all, and that's clear.
Yeah.
But in these others, what would they consider justice when they're coming?
Yeah. So it's interesting. Sometimes we don't see it as much as the people who are HIV positive and their status have been disclosed. There's a lot of psychological effect. There are people who imagine in a WhatsApp group where suddenly somebody discloses my HIV status. We have 50, 60 people. Nobody has ever known about that. So suddenly people start treating me differently. And there are people, actually, some very sad cases where people move away from where they've been living. Any other enemy who you had and had something against you, now when you meet, they just tell you, oh, Nyamaza, HIV. So there are people who even come with evidence. They've gone to see psychiatrists, counselors. They come with all those evidences of the trauma that they have gone through as a result of their disclosure. We have a case where even the kids who you've never disclosed to your kids, your adult children, your HIV status, then they get to know through third parties now. And, Dad, is this really true? What happened? Now you have to, those kind of strained relationship. How come you never told us all this? So they bring evidence of what has happened to them. And then we listen to the case.
But in that case, what do they want? Do they want the other person to acknowledge? Do they want to be compensated? Do they want
Yes.
reparations? Do they want the person to be jailed? What, according to them, is justice?
So the tribunal has no criminal jurisprudence. It's a civil matter, so we cannot order for somebody to be jailed, but you can be fined. So they usually want this person who is disclosing, there's a risk that they'll continue disclosing. So that's one time they've done it. So we want caution to that person, restraining orders that they do not continue disclosing your status. I have gone through this psychological trauma. I've spent money. I've been having counseling. I've spent 50,000 shillings for treatment. I want a refund for that, because if it wasn't for the disclosure, I would not have spent that money. And then I want compensation. I want, and the court, the tribunal then uses precedents, what has happened before in a similar case. So it'll award maybe 1 million shillings, 1.5 million shillings, just to compensate the person for what they have gone through.
I mean, just look again, starting to look at numbers, and the numbers were devastating when we first saw HIV make its entrance, in the world. And now when you look at what the tribunal handles, and what kinds of cases then are we looking at? I mean, now we talked about, yes, there would be somebody using information, but what kind of cases, and do these cases in terms of their adjudication then serve as deterrent for them to stop happening, or do we see that it is recurrent because of other things that would happen whereby it would set an example, or it would set precedent that because we saw a ruling in this matter, we saw then the decline of certain behavior, and then you wouldn't see such cases come. But because of the nature of HIV and what happens when such a case would come before you, I would assume, and probably in naivety perhaps, that it wouldn't change, that it would continue, because it is factual and it's also subjective at the same time. So how then do you see that it changes in terms of the numbers and the kinds of cases that come before the tribunal? And can you really say that because you've judged in this matter in one way, that the likelihood of you seeing another then reduces?
Yeah, and that's a good question. And that is where publicity comes into place. And that's where places like the media, that's the reason why I'm here as well, is that there are cases that we determine, but people don't get to hear about it. We need to have the media to highlight those cases. One of the things that I forgot to say is that because of the confidentiality of the people who come to the tribunal, we don't use them. So you'll not be able to read and say, oh, Jaoko's HIV status was disclosed by CT, and CT was fined 1.5 million. So, hey, be careful. So we use initials. So we just say WJ in a matter of WJ versus so and so. CT. Unfortunately for CT, his name's already initials.
We can't really change the initials.
maybe you go back to my name.
Yes. So that. What you're saying is actually the aim of the tribunal, that there'll be so much publicity that people will get to know that you cannot do certain things. Unfortunately, we have all this. I think one thing now, since I joined the tribunal, I've seen only one case in the newspapers, in the Daily Nation, that was highlighted saying so-and-so was fined, I think it was 1.5 million shillings for disclosing somebody's HIV status in a WhatsApp group. But there are many people who don't know. So it will not act as a deterrent because they don't know. So the more publicity we get, then people know, you cannot do that.
Yeah, because if you're going to pick up a gun and go shoot somebody in the head, we're going to know it's wrong, right? And people have this knowledge, even if it's generally that, okay, you don't want to do something like that. So are we saying that people don't have the knowledge, and we're talking about brick and mortar knowledge, or are we talking about the sensitivity that you don't just go around saying that because you know something, you don't just go around saying that X person is HIV or we've seen their blood sample? So the sensitivity of knowledge is what we're talking about here, not the real factual information. So are we saying that we need to sensitize people even more? Because I remember when HIV came about, when these campaigns, it was the ABCs, right? And there was a sensitization and there was stigma, and we needed to even change. We stopped saying things like victims. We stopped using those words. But now here we are talking about a different kind of sensitization, whereby we need to say, well, you cannot talk about this person without even with their consent. You still must be sensitive. So is it more in the sensitization and awareness of how we treat or how we speak of HIV than knowledge of the disease itself that's front and center, even today, 2023, when we're celebrating World AIDS Day today? Has it changed?
I would put it this way: it's a mixture. It's a mixed bag. For our generation, it is the latter, where we know enough, we have enough information about HIV. It's just the sensitivity that is like, people don't even think about it. They just think, I've hit you, I've scored by letting people know your HIV status. And they don't really think about the consequences on you and that there is a law. Some people are not even aware that there is a law against that. And so they break the law in ignorance. They really don't know. And they get surprised when they get summons that you disclose somebody's HIV status in a WhatsApp group, and that is against the law. So that is, I see that more of our generation. The younger generation, and here was a question about the young people. The knowledge of HIV is a bit wanting, in the sense that they've got the impression now HIV is just like any other thing, a common cold. You just recover it. And from my perspective, I think there are two reasons for it. One of those CT has already said, we don't get the HIV messages repeated the way they used to be during the beginning of HIV. So when was the last time you saw a billboard, a poster telling you about HIV and all this, the risks for HIV and all that? Number two, the young people have not seen the consequences of HIV. When we were growing up, we'd see people slim, get people growing thin, and every skin color changing, and people say, whoa, I don't want to be like that. You'd hear that, that's a HIV person and all that. The young generation, as a result of ARVs, we don't see that anymore. So they have taken it very casually, and it's no wonder that it is in that particular young generation that the HIV issue is really becoming much, much serious. Sounds to me like, a two-edged thing. On the one hand, it's positive because then there's no stigmatization for HIV. Right. And then on the other now, it does not compel them to take the precautions as seriously as they ought to. So how do you address that now? Because those are two things. If you started now putting up billboards all over, you're introducing stigma.
No, actually, no.
You may. You run the risk off, depending on the message.
You may, Eric, what you're saying is actually true, but what you're doing is you're actually highlighting something that exists. And it often gets to the question of, there are very many diseases that kill people and kill people horribly. Why did HIV get the stigma status higher than everybody else's?
Because it's connected with sex.
Precisely. Because in many communities in this country, sex is something that people participate in the dark, under a blanket. Under the table. Precisely. Now, so now, when you want to talk about it in broad daylight, that becomes a little, should we actually be talking about this? Just look at the euphemism we use for sex. Just, every day. Bad manners. Ding, ding. Why you look at me like that? We choose euphemisms. It's not something that people openly discuss.
So can I ask a question then?
Yes.
Is stigma then created out of lack of knowledge?
It plays a part.
Or is stigma created out of just wanting to be unsympathetic to a particular issue?
Let me ask.
Because if what we're saying is that if you create knowledge about something, that you subliminally create this stigma, whereas you could have just left it where it was. Nobody was really, going at anybody for whatever reason. And everybody was okay, quote unquote. However, then we see this other side start to suffer because we have a generation of people, if I'm not wrong, the most infected by HIV today are young people.
Yep.
Dr. Elizabeth, who was here, was really worried.
Professor
Bukufi, and telling us about, my goodness, the information that was there some 20 years ago about HIV needs to be reinvented in this day and age because young people are getting infected at a rate that is very uncomfortable. So, if you spread awareness, creating stigma, but inadvertently, even without an intention to. But if you do not create that information and that awareness, you will lose a whole generation of people and lose the fight again. So it becomes...
Consider the norms that we associate with communities and what people consider to be norms. Now, the norms also include myths and misconceptions, okay? Then throw in ignorance. Okay? And then just throw in attitudes that develop around how people have done things for the longest time. Case in point is mental health. How do people respond to mental health? Precisely. It's one of these things that people really don't want to sort of like go into. Now, why? Most of it is because we don't understand it. And then when you don't understand it, and then the myths and misconceptions, you're afraid. You don't actually even want to understand it. Okay? So, the moment you have that attitude where you'd rather not deal with it, you're talking stigma. Because if there was no stigma, you deal with it.
Ah, right. So you don't deal with it. You're stigmatizing it.
Because of stigma.
Yes.
So you get the right messages. So what you're saying is we are not asking for billboards showing people who have lost weight
and saying HIV,
and telling you if you're not careful, you are going to, there is a song at the height of
pandemic.
The Longoma one, you just say kata pumzi, anatuacha,
Vuta
pumzi, because they say, you can see somebody who is doing well, but be careful, anatuacha. That is a very wrong message. But it was at that height where we're saying, you're warning people that, you see somebody flashy with money, be careful, having sex with such a person. You don't know. He'll be leaving us because of that. Now, we don't want those kind of messages for now. We want people to have information. And even in the messages that you'll be passing, there's also something about not discriminating against people who are HIV, but encouraging people to go and know their status. Because actually, if you look at the WHO, UNAIDS, 95, where 95% of the people should know their HIV status, 95% of the people should be put on treatment, and 95% of the people should have viral load suppression as a way of removing HIV as a public health problem by 2030. It depends. It encourages people to know their HIV status, and it removes the idea of stigma, because anybody can just tell you, I've tested, like what City was saying. Even if you said, I'm HIV positive, but I'm on medicine, and people look at me and say, oh, okay, it is not that bad. So it's a
tricky one.
Yes,
but
it's
also,
a tricky one.
Prof. There's a generational difference. This young generation of today, they're very open in conversations about sex.
Yeah.
Unlike the older generations, you guys and us guys, the sex, even among peers, was not a very direct conversation. The younger generation, more open, even on mental health.
Yes.
So you find that people will even talk about, going to see a counselor, I'm seeing someone, I am in therapy. The young people will openly talk about that, and they're more aware about mental health. They are not quick to judge somebody saying, you do not know about them. So there's a greater awareness. And then there's ease of communication. Maybe that already is an inroad into talking to them about sex and the other effects of sex. Because like Ndu will remind us all the time, having worked with young people, what they fear most is pregnancy. The greater fear is, sex. They know sex. pregnancy, and then what does that do to my life?
Yeah.
HIV is and STIs are secondary to that.
Yeah.
So how then do we
Yeah.
amplify the HIV message?
That's true. And actually, that's why we have the International World AIDS Day, just to look back as to how much we have progressed from the time HIV came into the world. We also remember people we have lost, people have relatives, friends, family who passed on, and then ask ourselves the question, what can we do to prevent this continuing to be a problem? And those discussions are important. Yeah.
Should young people lead these conversations?
Yeah, we actually have opportunities. There are a lot of cities talked about. We have a lot of groups of young people all over the country, actually, where these conversations are taking place. Young people also would want to see a champion, a young person who is open about this. In our generation, we had people who came out very strongly identified with, say, they were HIV positive. We started appreciating the fact that this, then just normal people like us. So the young people, if you get some champions, they might be HIV positive or not even HIV positive, but they go out to publicize the messages. The generation gap is quite difficult to jump. If a young person is involved in these messages, it's much easier than to be listened to rather than us.
Ancient creatures like ourselves.
Yeah. It's like you don't understand the world. You're on your way out.
How does one get to contact the HIV and AIDS Tribunal?
Okay, so we have the tribunal is headquartered at Reinsurance Plaza, 9th floor. 12th floor of Reinsurance Plaza, but we have a presence at county level in many of the counties. But we also have, if you go to any court all over the country, you'll be able to get information on if you want to file a case about something about HIV to the tribunal, you'll get assistance in any of the courts.
Online?
So our online, there is an email. Unfortunately, I don't know it offhand. There's an email that people can use to contact the tribunal. All our hearings are done online to make it convenient. I think COVID brought something very nice. In the past, they used to go all over the country sitting, or people would have to travel from all over the country to come to Nairobi. But now our cases are online.
So all your hearings are now online?
They're online, yep.
Okay, somebody does not have to.
Yeah, they don't have to. What we try to make for face is cases where they're minors, where they're children. Then we do a face-to-face.
How much to file a case?
Free. That is one of the things that the government has done. Any other case you file in court, you pay. But for the HIV tribunal, you don't pay. You don't pay, you get free a lawyer, a pro bono lawyer. So they've tried to really make it easy. It's a human rights approach to the HIV, addressing the HIV issues, so that everybody gets justice, and justice can be expensive. So the government has made it free for this matter. And
you're guaranteed to get a conclusion of your matter within 6 months?
Within 6 months.
Okay. Thank you very much, Prof, for joining us.
Thank you.
And as you commemorate World AIDS Day, from all the work that you've done, also we celebrate you as we celebrate CT here all the time for all the work that you've done in this particular field.
Thank you.
Researching and working in communities and spreading awareness on HIV. Professor Walter Jaoko, OGW. No, you need to be.
I don't have any of those.
Chief of the Order of the Burning Spear. As our guest this morning, HIV and AIDS Tribunal member and director of the KAVI-Institute of Clinical Research at the University of Nairobi.
This is the Situation Room, the only way to start your day.